Chandler Converse comes to us believing that physical education, also known that you might see it as PE here, should be made available to all students. Chandler launched AKA, Athletics Plus Kids Equals Academics, her own grassroots student fitness initiative in Georgia, linking physical fitness to academic success. As a voice for physical education and fitness for youth, I'm looking forward to hearing her testimony because I believe our young know more about what we can do to help them live healthier and more active lives.
Good afternoon, Madam Chairwoman and members. My name is Chandler Converse. I'm 15 years old, and I'm a freshman at Pebblebrook High School in Cobb County, Georgia. As a public school student, a young woman, and an American citizen, I'm honored to be speaking to you today. I am here on behalf of all of America's children. You see, I believe that kids have a voice. Since I began my own grassroots and student fitness initiative in 2004, I've been trying to encourage everyone to take seriously the health and well-being of this country's youth. I call my initiative AKA, Athletics Plus Kids Equals Academic. The link I'm trying to get policymakers to see is simple, that increased physical activity, even 30 minutes a day, and better nutrition can lead to increased energy, improved self-confidence, better sleep, less absenteeism, and yes, we do better on tests too. I have done my homework on this. I've spoken with my peers, and this may sound surprising. I found that most students want more exercise. But for most American students, the children of working families, for latchkey kids, and others, school is the only place they have for exercise. I have also spoken with many of our nation's leading health and education experts, elected officials, and the media. I've told them all that childhood obesity often leads to life-threatening illnesses like heart disease, cancer, diabetes, and depression. I've written to most of my state's 181 school superintendents. I've convinced the principals in my schools to switch some of the junk food in vending machines to healthier choices. And I have served on my school district's Wellness Policy Committee. All of the above is a start, but it's not enough. As you will hear, during the course of the planning process, during the last school year, I heard comment upon comment from administrators on the committee. We don't have the time or the money to add more PE classes or to build a track or a new playground. We need to get our test scores up. I also heard that many schools believe they will lose money if they lose their vending machines. I ended up being the only member to attend off-site policy training workshops. I became the only member to address the first administrative training workshop in our district last October. We developed our policy by last summer's deadline. It includes a recommendation for 30 minutes of exercise a few times a week for students. Since that time, I've heard very little about our wellness policy. I found that most students and teachers in many parts of the country are completely unaware that schools have wellness policies. For example, last November, as I addressed a state educators conference, I asked how many in the room knew that their schools had new wellness policies. I asked for a show of hands. I was amazed to see that from a room of 40 physical education teachers, only 2 hands were raised. While there are some schools across the country which have made positive changes, I believe the situation I have just described is representative of what is really going on. Let's face it, just like in traditional school cafeteria food, it's hard to find the real meat in existing school wellness policies. The longest line in my school cafeteria are for pizza and French fries. I still see students spending their lunch money on ice cream and soda. As a kid, I know that if healthy foods were made available, that my peers would line up for them. My generation may be the first one to have a shorter life expectancy than our parents. How can a nation that has prided itself on medical research, which extends the lives of its citizens, allow the reverse to happen with its children? My goodness, as children we must learn everything, but while we're learning reading, writing, and arithmetic, please teach us how to lead healthy lives too. I understand that this is not a quick fix. However, it took 40 years to get effective tobacco legislation passed. My generation does not have 40 years. In 3 short years, I will be voting. My generation is going to lead this country one day, soon. America cannot be strong if it does not have strong, healthy, self-confident citizens, both adults and children. I believe kids have a voice. Please make the wellness policy stronger at the federal level so that all schools must comply. That way kids will receive enough exercise to fill our lungs, to raise our voices. Kids do have a voice, and I thank you for listening to mine.